The What Women Want interactive board allows for a duly and matched level of access into women's demand by connecting women's voices with the almost infinite possibilities of digital analysis. We really see this as a one-of-a-kind resource. So when first accessing the What Women Want dashboard, this is the default view. There are buttons at the top of the dashboard that allow users to find out more about What Women Want campaign that was done in 2018 and results published in 2019. Watch an overview video and then activate a step-by-step tutorial that will walk you through the dashboard directly in your own time. The first stop in using the dashboard is to go to the section in the upper left that features the filter tools. Within this section, you will see two tabs. One allows you to drill down to get more specific information on response by country, category, age, and even keyword. Let's choose Kenya for now. The other tab allows you to compare two types of responses. This can be especially useful when attempting to contrast the responses from countries or to find similarities and differences between various age ranges. Let's choose Nigeria as the comparison. The upper right of the dashboard shows the number of women who responded, either in total or for the specific filters you have selected, and a histogram of their ages. Next slide, please.
Across the entire campaign, we were able to hear from women and girls from 114 countries, but most responses came from areas where White Ribbon Alliance works and where we were able to mobilize our extensive networks of supporters and advocates. The dashboard only highlights responses from countries that collected a significant amount of demands, about 10,000 or more.
Directly below the filter section is the breakdown of women's responses by topic box. As I mentioned earlier, over 1 million responses were coded and categorized by White Ribbon Alliance, either through extensive hand coding or through digital means, including natural language processing and machine learning techniques. Our code book separated responses into 39 categories to cover demands ranging from more and better health professionals, water, sanitation and hygiene, and respectful and dignified care. Our code book is available online to allow anyone the chance to see behind the scenes on how coding and categorizing decisions were made. This is just another way we attempted to be as open as possible with this work.
Immediately to the right of the category bar graph is a box that shows a sample of 1,000 responses. The responses reflect the categories you have filtered for, and the sample is changed every time the page is refreshed. And the great thing about this dashboard is that you don't need to take White Ribbon Alliance's word for any of it about what women were saying, because unlike other health questionnaires, which can turn women into maybe unknowable graphs or printouts on a PDF or some static diagram, this allows you to see each individual respondent's exact words. And as was mentioned before, throughout the campaign, it became abundantly clear from the women and girls responding that they wanted their voices to be heard. They wanted this campaign to matter. This demand for openness and the desire to be listened to is at the heart of the dashboard. And you can see that most clearly here in this section.
Below the breakdown of the category bar graph is a section that focuses on the top words and phrases mentioned within response demands. There are 3 views available: one-word response, just like respect, two-word phrases, or three-word phrases. This allows for much fuller understanding of what was actually being asked for and how it was often phrased and grouped and paired with other demands. Let's say we wanted to take a deeper look into women's demands in Kenya for respectful and dignified care. As we look at the top single most phrase, rising to the top is doctor, respect, woman. This might give you a general idea of what women were asking for. But let's click into the 3-word phrase tab. Just look at the responses and you see abusive language, good communication skills, use polite language popping up. Women and girls are fed up being treated poorly at health facilities. They wanted to be spoken to with kindness and respect.
Now, you'll see on the map to the right that Kenya is highlighted right now. But let's see how the dashboard changes when we click on India and then Pakistan. And while that's loading, we're really starting to see the more interactive aspects of the dashboard. So we can head back up and explore the drill down features in a bit more depth together.
You've seen how when selecting a country, the dashboard will filter and show only responses from that country. But you can also select multiple countries to look at responses from an entire region. Let's add Uganda and Tanzania to the mix to see the dashboard at a regional level. This will be the East African region. This selection process can also be done with age ranges, response topics, and keywords. If we wanted to know how Kenyan women aged 20 to 30 demands related to water, sanitation, and hygiene, we can set those parameters with our filters. So you will see the dashboard is now filtered to only show responses that were tagged WASH in Kenya for women aged 20 to 30. We can drill down even further by searching within this category for the keyword water. We are now only seeing the times water was used within the WASH code. We can also exclude text. Let's try exclude drinking. Now the dashboard is only showing us water in context outside of drinking. You can see what women were requesting when it comes to having access to water for washing or bathing. I know cleanliness is a huge policy issue right now, particularly with the ongoing COVID-19 pandemic. So another example we can try is looking into clean. We are going to clear the search term functions and replace water with clean to see how the dashboard changes. We can now exclude water to see responses that just had to do with basic cleanness and not the request for clean water.
And it's obvious to see that women and girls are tired of receiving care in dirty health facilities. When we're looking at their survey responses, we see that they urgently want cleanliness throughout the wider environment, ranging from labor rooms to hospital beds. Globally, this desire for cleanliness actually accounted for 65% of women's total WASH demands. And it's really quite telling. And it shows us that there's a huge problem with cleanliness globally. And I don't think that's a coincidence either, since environmental cleanliness is widely ignored and not prioritized on a policy level. But now, as an advocate for women and girls, you can use this dashboard to help make the case for the importance of investing in environmental cleanliness in health facilities, not just globally, but also nationally and at local levels too.
Exactly. For example, in Kenya, where we are implementing the Universal Health Coverage Project, we've empowered women and girls living with disability on their health rights to advocate for change at their local health facilities by having conversations with the facility management to ensure that the delivery of care meets the definition of quality, that is increased cleanness, clean linen, clean delivery beds, clean delivery rooms, privacy, disability-friendly facilities, just to mention but a few. Diana?
We know that this is a strategy that works too. Recently, the Niger state government in Nigeria made a policy commitment wherein focal primary healthcare facilities in the state will increase the number of clean, working, functional toilets from 3 to 6, so doubled. Why did this policy action happen? It's because WASH was the #1 What Women Want request from women and girls in that state. And leaders are listening to women and acting on their demands.
Who knows what else is possible and what other life-changing policy decisions will be made because women's voices were actually listened to and because their own words were actually seen. The dashboard allows everyone, everywhere, the chance to examine what Women Want campaigns' responses at a unique level of detail, a first for transparency in the nonprofit sector that we hope to see replicated in other organizations, campaigns, and